The great Dr. Henry Cotton. Psychiatry was his occupation, but his true love was in the field of butchery. Surgery, of course. Truly a pioneer in the treatment of mentally ill patients. You might be wondering what I'm talking about right now. Well, you see, Dr. Cotton wasn't an ordinary psychiatrist. He had quite a progressive stance on the treatment of mentally ill patients, removing teeth, colons, ovaries, spleens, testicles, you name it, he'll remove it, all in order to make you feel better, of course. You see, he believed that mental illness had its root in all sorts of infections. Before becoming the prominent doctor of New Jersey State Hospital in Trenton from 1907 to 1930, he studied in Europe under Emil Kraepelin and Alois Alzheimer, as well as Adolf Meyer, all huge names in the field of psychiatry. Meyer was even one of the first to recognize and identify patterns within some illnesses. He advocated for a more structural approach, communal activities, and changes in person's life. In fact, it was Meyer who somewhat molded Cotton's idea of mental illnesses being connected to bacterial infection, by observing patients with high fever having hallucinations. What prompted him to move forward with this idea was at that time in 1930 a recent study released about bacteria causing syphilis could potentially leave brain lesions that could then potentially lead to dementia. Now his experimental treatment began with removing teeth from 50 patients. That's right, 50 patients. Having seen some unsatisfactory results, he moved forward by removing tonsils, of course. Now this is when the crazy begins. After he saw some satisfactory imaginary results, he moved not one but several steps forward. If results were unsatisfactory, that just means that the root of the infection was not within the mouth. He then moved to gallbladders, ovaries, uteruses, testicles, colons, you name it. Nothing was off the table. Well, it was technically off the surgery table, if you know what I mean, but not off the table. In fact, he was such a believer in this theory that he even removed some of his own teeth, including his wife and his 2 sons. I'm not joking. Later down the line, he would even criticize dentists for, why would they treat teeth? That's just a complete and utter waste of time. You just need to pull that fucker out and that's it. At one point, 30% of his surgeries resulted in the death of a patient, which then consequently scared other patients to go to the surgery, and they had to be dragged there. Keep in mind, antibiotics were still a few decades away. Now you'd think that 30% death rate on a surgery would deter him, or at least stop him, make him go easy, but you'd be wrong. To deal with the restless patients who refused to go to the operational table, he had a genius idea. Just replace your male nurses with your female nurses, and that's it. He claimed that female nurses had a calming effect on the male patients. He was so proud of his so-called achievements that he gave periodically presentations and tours over UK and Canada. In fact, he enjoyed publicity quite well. He gave tours and invited press over to the Trenton State Hospital as often as he could. His popularity with general public was quite large at that time. In fact, so large that down the line he had to open his own private hospital for the, let's say, money-savvy ones. Luckily, not everyone bought his story of successful surgeries, and some were extremely skeptical and refused to treat the patients by butchering them. Cards started to slowly fall down for Cotton once a daughter of a very wealthy man, Irving Fisher, died as a result of streptococcal infection. Kind of ironic, right? It all started with infections and then started to fall with infections. Has a poetic ring to it, you know. Anyway, Dr. Meyer became skeptical after privately visiting the hospital and taking a look at the lack of correct statistical information regarding his work assessment. But don't be praising him just yet. We'll go to why in a bit. in 1924 began an official investigation into Dr. Henry Cotton, led by Dr. Phyllis Greenacre. What she found out at the hospital disturbed her, from the surroundings to the patients who were missing teeth to the chaotic reports and contradictory findings about his methods. So what she did was observing 66 patients' records. It would be more appropriate to call them victims at this point, and found shocking discrepancies with what Cotton was preaching. 17 patients died right after surgeries, while several others were not that lucky. They had to suffer for several months before they finally died. Conveniently, these cases were not included in his high success rate. In fact, only 5 out of 66 recovered completely, while 3 only improved slightly. This gave Greenacre a hunch, so she contacted former patients that were supposedly discharged, fully cured, and surprise, surprise, they were still unstable. All of these findings, if published at the moment, would surely mark the end of Cotton's career. But as we know, he worked well after this. How so? His mentor, Dr. Mayer, was the one who actively suppressed Greenacre's reports and findings. He understood them quite well, but his arrogance did not allow him to admit this. His protégé was doing such things? How preposterous. Rather lucky, in 1925 the New Jersey State Senate Committee developed an interest in our great doctor and started a formal investigation in the Trenton State Hospital. It was a two-sided battle of testimonies from disgruntled former employees, patients lucky enough to be alive, and his loyal trustees who saw him as a pioneer in the field of medical science. And what did our medical pioneer do during this investigation? He went mad. Totally, fully, completely unhinged mad. All of a sudden. I'm not joking, he went totally mad. Which was convenient, of course, because a Senate committee soon lost all interest in him and his asylum. And the findings of Greenacre were buried down quite well by our formerly mentioned Dr. Mayer. And what did happen next to our protagonist, you might wonder? He cured himself. Miraculous, I know. Who would have thought so? That was the teeth removal thing I mentioned from a while ago. He just plucked them out and all of a sudden he was quite well. Who would have guessed? It's quite miraculous what doctors could do back in the day, right? I mean, having bipolar disorder, paranoid schizophrenia, ADHD, no worries, we got you covered. Just come down to our local surgery table and we'll remove that in a jiffy. Now that all was well in Henry Cotton land, now that he was mentally sane again, guess what? He was still in a quite popular demand. His tours didn't wane, his presentations were in high demand, his opinion on all sorts of things was in high demand, press still loved him, general public still loved him. Nothing changed. In fact, the only thing that quite changed was that he opened a private hospital, his own private hospital, of course, for the wealthy. I mean, the procedure still didn't change. It was still the butchery table here and there, taking out some spleen, some colon, some nuts and sacs, and that's it. Luckily, for most patients, at 1930, he retired and became a honorary board member of the Trenton State Hospital. But as his stupidity didn't know any bounds, he still advocated some really stupid things, fucked up surgeries like removing a part of the colon from children, doing a sort of colectomies, not only to prevent them from going insane, but also to stop them from masturbation. Like, what the hell, man? When's it going to be enough? When's it going to stop? I mean, you remove the people's ability to chew, you remove people's ability to shit properly, you remove their abilities to reproduce properly, and now you're going to remove their abilities to free willy once in a while. Like, come on, man, have some compassion. I mean, imagine if you were a kid back in the day. How are you gonna release all that pent-up frustration? I mean, what the fuck are you gonna do? Play in a garden with other children? Who does that? Oh yeah, by the way, his practices and surgeries were still ongoing, even though he was in pension. Luckily for all the patients, this time finally, an investigation by the hospital's board, carried out by the head of the New Jersey Department of Institutions and Agencies into our main protagonist, was about to happen. They cross-examined records of Cotton's 645 patients that underwent surgeries with 407 patients that did not undergo any surgery. Guess what they found out? Yeah, the recovery rate was quite higher with patients who did not have Cotton's surgery. Of course, he and his most fierce supporters claimed that these findings were not truthful and were smear campaigns against him. In one, last of these disputes, Henry Cotton died of a heart attack in 1933. So, our main protagonist, the butcher, Dr. Henry Cotton, was directly responsible for 11,000 teeth pullings, 645 surgeries, and over hundreds of deaths. Now what's funny is when he died, Times magazine as well as some famous European outlets claimed that he was a sort of a humanitarian and a great pioneer in the field of medical science. For some reason. Because of his idea of butchering people any way he seemed fit, he was quite borderline charlatan. Oh, this story was a wild one. Quite a ride. Now, what do you guys think about this one? You can write your comments down below and I'll read them and I'll try to reply to all of them. Now that's it for today. I'll see you in a couple of days, maybe even sooner. That's it. See ya. Oh yeah, before we go, if you don't mind, you could at least subscribe and like the video. It means a lot. Thanks.